The following is an exclusive presentation of Meet the Leaders, only on Optimum. We're your TV, phone, and internet company.
Coming up on Meet the Leaders, drug and alcohol abuse has been on the rise on Long Island. What is Suffolk County doing to combat this epidemic? Meet the Leaders starts right now. Hi, I'm Pat Halpin. Welcome to Meet the Leaders, the show getting you to the heart of local government right here and right now. From the Suffolk County's 10th Legislative District, Legislator Tom Cilmi. Tom, it's great to have you back on Meet the Leaders.
Good to be with you again.
What are the communities you represent in the 10th LD?
Islip, East Islip, Great River, a little bit of Islip Terrace, a little bit of Central Islip, Islandia, Bohemia, Ronkonkoma, the Islip side of Hop Hog, and a tiny, tiny little bit of Oakdale.
That was really a test to make sure you didn't leave anything out.
I think I got everybody.
And I know you.
It ain't easy,
I
but
know
I think
you
I
got everything. Well, it changed as a result of
It
reapportionment but the legislative districts in Suffolk County really didn't change all that dramatically with some adjustments for population. So
yeah, mine changed about 25% actually in terms of
which is actually fairly significant.
significant.
Yours was a little bit more than most. So you can't pick up the paper without seeing stories about the drug and alcohol and substance abuse epidemic that seems to be sweeping this country, sweeping Long Island. Mm-hmm. We've seen a big change in terms of people who had been addicted to pain pills with the crackdown there, shifting to cheap heroin, and that's been a dramatic shift. Typically, the responsibility falls to the county in terms of enforcement as well as treatment, and I know that's something that you've cared deeply about.
Yes.
Talk to us about what's going on.
Well, the issue is really important to me, first of all. My dad was an alcoholic. I can remember as a child going around to the local neighborhood stores and putting up "Say No to Drugs" signs with my mom, who was involved in the issue.
God bless her.
I remember the year that I ran for office in 2009. I was celebrating New Year's Eve with my in-laws, who, by the way, Josephine and Pietro, happy 50th anniversary to you. They're celebrating their 50th anniversary this year.
And they're in West Babylon.
They're in West Babylon, but that New Year's, two 14-year-old young men were out celebrating, riding bicycles, and they both apparently fell asleep after drinking in the street. New Year's morning, one of them woke up and went home. The other one never woke up. I promised myself at that point that if I were to be successful in my run for office, that I would make this an issue that I would focus on.
Right.
And since that time, I've spoken with many, many school children and have come to the conclusion that roughly 60% of high school children are drinking on a regular basis. And that's alarming, because the drinking is a gateway to pot, which is a gateway to pills and to other drugs. So I've seen the anguish and just the sheer devastation on mothers and dads' faces as they talk to me about their kids and their addiction problems. And so it's something that's important to me personally, that I have some personal experience with, and that really should be important to every resident of Suffolk County, because the impacts of it reach much past the personal pain involved in addiction.
But you're right. I mean, there probably is not a family anywhere in this region or in this county or in the nation that one way or other hasn't been affected by the very story you just told.
Yeah. Well, I say to folks, if you don't personally know somebody who's got an addiction problem or a substance abuse problem, then without exception, you know somebody who knows somebody who has that problem. And even if you escaped that, the money that's spent on dealing with this issue is remarkable. New York State spends close to $800 million annually on substance abuse prevention and treatment. That's a lot of tax dollars. Our police department, our court system, our jails are all but consumed with this problem, and that's a lot of tax dollars. So regardless of whether you know somebody who's been personally impacted, from a tax perspective, we're all impacted. From a community perspective, we're all impacted as we see a rise in local burglaries and such that impacts our quality of life.
And the epidemic is also getting worse as a result of easy access to cheap heroin.
Yes.
What's happening? Where's the stuff coming from?
It's
How's it getting out there? The DA just the other day had a big story about cracking down or arresting a couple in Holtzville.
Yeah, we just
who were
indicted
dealing.
14 residents from throughout Suffolk County, 2 or 3 of which are from my district that were involved in the heroin trade, and apparently it's coming from Brooklyn or somewhere in the city. Out in this case, out to Holtzville, they had 40,000 bags of heroin in their home or something. But I mean, obviously it comes from across the borders into the big cities, and then through a network, because it's so inexpensive, through a network of dealers, comes out to the suburbs and is a huge problem here in Suffolk County.
But this is something that cuts across all socioeconomic groups. People look at, upper, middle class, Caucasian families. Oh, that's not a problem in our neighborhoods. What are you here to tell them?
I'm here to tell them that it absolutely is a problem in their neighborhoods. The drug dealer of 20 years, or the drug user of 20 years ago, is not the drug user of today. Today we're dealing with people who are academically advanced, who are involved with athletics, music. It's not the stereotypical fellow or young lady who's sitting somewhere in the corner with a needle in her
this
arm.
isn't the crack epidemic. These are not junkies in a drug den like you see on TV. This could be happening in people's den or their child's or their teenager's bedroom.
So, and the best way to combat it as a parent is to be very involved and engaged and aware of what your children are doing. I always tell parents that better to have your children upset with you for invading their privacy than to have, God forbid, dead children. So watch the cell phones, know who your kids are with, when they're with them, know what they're doing, look for signs, changes in behavior, reclusive behavior. Look for those signs and engage your child in conversation about it.
Okay, you've done a great job in laying out the problem and how serious it is. When we come back, we're going to take a short break. I want to start getting into what the county is doing about it, what we all need to be doing about it. We know what's happening from enforcement and treatment, and as you just so eloquently did, education to really get the word out. Okay, so we'll have more with Legislator Tom Cilmi about the drug epidemic and what Suffolk County is doing about it in just a moment.
This is the ocean, and this is Kipper. Kipper doesn't live in the ocean, but if she did, this is likely what would happen. This is Sparky, and this is habitat destruction. Boozer doesn't like it, neither does Fluffy. We wouldn't let this happen to Kipper, Sparky, Boozer, or Fluffy. In the oceans, it's worse. Lacking opposable thumbs, Kipper can't take action, but you can. Visit BeringSeaCanyons.org.
Did you get a call from the coach about those kids who were caught drinking?
Not our guys. They know better.
Yeah, they know better.
Heads up, sport.
Real kids are curious about alcohol. 40% tried by the 8th grade. Talk early, talk often, get others involved.
I'm New York State Assemblyman Edward Hennessy.
And I'm Jim Nostrom with the Long Island Cyclists and Runners for Safety.
Hit and run fatalities are at epidemic levels on Long Island. Last year in Suffolk County alone, numerous fatalities were attributed to an individual leaving the scene without reporting it.
Runners and cyclists, make sure you are visible and follow the rules of the road.
Drivers, if you think you've hit someone, stop, check, and call the police. Be aware and share the road.
Welcome back to MTL, here with Suffolk County Legislator Tom Cilmi of the 10th Legislative District. Tom, you were talking about the drug and alcohol and substance abuse epidemic that is sweeping this country. I mean, everybody was caught up with this show Breaking Bad, which talked about the meth epidemic that's happening. And I don't know whether they glorified it or not, but it was really chilling that that's going on.
Right.
And but what's happening now with heroin and pills, you know, a lot of people got addicted to pain pills, and we had that terrible murder in Medford.
Right.
And now what's happening is that you can't get access to those pills. So a lot of people are getting this cheap heroin because they're all opiates, aren't they?
Well, much of it is. And I wouldn't go so far as to say that you can't get access to the pills. The pill problem is still a big problem.
You're right.
However, that said, the pills are expensive. Kids are still getting them from their parents' medicine cabinets, and we all have to be very, very careful about what we leave in our medicine cabinets. But once they're out on the street, they become very expensive to sell. So people now are switching to heroin, which it can be $10 or $15 a bag for the kind of high that you'd have to, spend, $100 for in pills.
Is the quality of the heroin that pure?
Yes, it's much more pure than it was in the past, which is why it's less expensive and why it's more dangerous.
So, talk to me about the county's response.
The county spends a lot of money. Most of it comes from other levels of government, but we spend about $19 million a year or so on substance abuse prevention and treatment. Part of the problem, however, is that I don't see that we have any cohesive strategy or plan to deal with the problem. We're spending a lot of money. Thousands of people are working really hard on the topic, but there doesn't seem to be any concerted effort.
Now you've put together a task force, haven't you?
Yes.
To address that very issue.
That's one of the issues that the task force hopes to address. We have the Republican caucus of the legislature got together at the beginning of the year, and we said, what are our priorities for this year? And one of them was taxation and the budget, so we have a task force designed for that, and one of them is substance abuse and mental health. So I offered to be the chairperson of that group. Certainly, if folks are interested in getting involved with that, they should look me up, email me at tom@tomcilmi.com. Fairly simple to remember, and we'll get you involved. But the focuses of that group are twofold. Number one is to keep the issue in the forefront, to do programs like this that we can focus on it so that people understand how big of a problem it really is. And two, to wrap our hands around the hundreds of millions of dollars that are being spent on this issue, and to try and figure out, is there a better way? Can we come up with a more cohesive plan and do a better job of spending taxpayer money to solve this problem or to take a bite out of this problem? We're not going to solve it, let's face it. It's not going to go away completely, but we have to do a better job at addressing it. In Suffolk County, we've lost, I think, 240 or 250 or so people to heroin overdoses in the past couple of years. One of the great things that the county has done over the past couple of years is develop a Narcan program. Narcan is a drug that is an antidote to heroin overdose or to opiate overdose, and it's a nasal inhalant that has no ill effects. So if somebody passes out and you think it's an overdose but it's not really, and you administer this product, Narcan, there's no harmful effect to it.
Right.
And it's easy to administer. So we rolled this out in 2012. We began training our police department, our sheriff's department, and our first responders. Our first responders have saved in the past 2 years more than 500 lives.
It's remarkable.
With the use of this product.
And really all that does is give them time to get this person to the hospital where they can really treat them for the overdose. But the question I have, and I'm sure people watching the show have, okay, so what happens after that?
Then? So one of the biggest obstacles to continued treatment has been the availability of beds, both inpatient and outpatient services. And a lot of that has to do with insurance-related issues. So Senator Kemp Hannon is sponsoring a bill at the state level, which has been co-sponsored by the entire Long Island Senate delegation. And our task force has issued a position statement in unanimous support of this legislation, which would require that insurance companies that offer major medical and all the major medical benefits also cover addiction services. And it would require that when they do, they rely on the advice of medical professionals to determine the scope of treatment necessary.
Because that's always been an issue.
Yes.
Where most plans do provide some level of coverage, but in the end, it's somebody on a phone making the decision.
That's exactly
that
right.
Tom, can get 2 weeks or 28 days, but after 28 days, it's over of treatment, and part of it's inpatient, part of it's outpatient, whatever it is.
Right. And what's happening all too often is that 28 days that you speak of
Yeah.
is really 2 or 3 days. So an insurance company will pay to have somebody go into treatment for 2 or 3 days.
Right.
Some bureaucrat in some other state determines that that should be enough, and they're out on their own. And it's the worst thing for an addict to be clean for 3 days and then go back to using after those few days, because their tolerance may be a little bit less, and yet they go back to using the same quantity that they had used previously, and that's what creates the overdose. It's very dangerous.
It's very, very dangerous. So that bill, are you optimistic that that's going to pass?
We're going to put a lot of pressure on the New York State Assembly as well as the rest of the Senate to take action. It's an uphill fight because the insurance lobby is very, very strong, but it's a fight that we need to win.
Now, Suffolk County has done some interesting things over the years. As we know, the sheriff has talked about this, but it's been documented. A lot of the people in our prisons as well as our county jails are suffering from drug, alcohol, and mental health problems. And Suffolk County has had this great DWI facility. If you get arrested for DWI and you're sentenced for 60 days, 90 days in the county jail, you can sit in that jail, or you could go into this program. Have you given some thought to expanding the nature of that type of service? I mean, in the end, you and I both know that there's a good chance if you're an alcoholic, you could be abusing something else, and you could also be having serious mental health problems simultaneously. So you're not just treating one thing, and of course, the treatment experts over in that facility understand that too.
Right. Well, first of all, there is a great deal of what they call comorbidity between mental health and substance abuse. But that is something that we're going to be looking at. Alternative methods of treatment, alternative modes of treatment. One option that's arisen is the use of the John J. Foley nursing home building for that purpose. But back in 2010, there was a Suffolk County created a heroin and opiate advisory panel, and this panel worked very hard. All folks in the business kind of got together and came out with a report that detailed 48 different recommendations, and some of those recommendations dealt with the treatment piece. So the task force that I'm chairing is in the process now of reviewing those recommendations to determine where are we 3 years later.
Good.
How many of them have gotten done? How many of them are sitting on the shelf? To see what we can do going forward.
So in other words, you really don't have to do the homework to figure out what the strategy should be. That's already been done for you. Now it's about trying to figure out how to implement the ones that make sense.
That's exactly right, except that we know that we are doing a lot.
Yeah.
We're working hard, we're spending a lot of money. Folks have said to me, aren't you reinventing the wheel here? We've had all of these things, these panels, these task forces in the past. And what I say to those people is that if the wheel isn't rolling, then maybe we ought to reinvent it.
Maybe it's time to put a different tire on there. Right. All right, we're going to take a short break. We'll be back in about 90 seconds, so stay with us. This is really important.
Why should you choose to fly Long Island MacArthur Airport? I'm ISA Town Supervisor Tom Cilmi, and the answer is clear. Close to home, no lines, convenient parking, a 5-minute shuttle from Long Island Railroad's Ronkonkoma Station, and Wi-Fi is now available at the airport from Optimum. Internet access while you wait for the flight. Long Island MacArthur Airport, the stress-free alternative. Relax, your vacation starts here.
The Terry Farrell Firefighters Fund doesn't have a telethon. It's not about being in the spotlight. It's about giving support to first responders and military veterans. The fund was established in memory of Terry Farrell, a decorated member of the Rescue 4 FDNY who perished on 9/11. The fund ensures that firefighters have the resources to protect the public. The fund also assists families of firefighters, first responders, and military veterans who are facing medical emergencies. Please support our mission by volunteering or donating. Visit us at terryfund.org.
Some goodbyes are worth fighting for. Help the Marine Corps Scholarship Foundation honor Marines by educating their children at mcsf.org.
Welcome back to Meet the Leaders, here with Legislator Tom Cilmi. Cilmi, who is the chair of the Mental Health and Substance Abuse Task Force, which has been organized by the Republican caucus in the Suffolk County Legislature. So we left off by saying on the issue of what can be done, what should be done, what's more that can be done. You mentioned that in 2010, a bunch of really smart people in this field, were brought together and laid out a plan, a blueprint with 48 different recommendations on what the county can be doing to deal with the substance and comorbidity, the mental and alcohol abuse that goes along with that. We know that the sheriff is, and sheriffs all across the country are overwhelmed by people who are in jails because of the very problems that we've been describing. Yet it seems to be growing. And so, the question, I guess I have two questions. Where can people get help? And what's the nature of the help that they could get for them or for family members? And secondly, what more can be done in terms of educating people about the consequences? So let's talk about help first.
Okay, so there are dozens of organizations that are out there working on this issue. If folks need help finding one of those organizations or finding an appropriate organization, I would suggest that they call their local legislator. All of us have access to that information, and all of us interface with those groups on a regular basis. So that's one place to start. Certainly the police department is another place to start. Emergency situations, obviously, you always call 911. But if it's questions about different treatment programs that are out there, or the laws as they relate to alcohol or substance or other substances, call the desk at your local precinct and they'll be able to direct you. Also, our health department is another avenue. I don't know that number off the top of my head.
But they could just look it up,
Suffolk County Health Department. We have a division of mental hygiene which has a subdivision that deals with substance abuse. So in terms of getting help, those are the avenues that folks can use.
There's a big debate going on. You saw, I believe it was the governor of New Hampshire, got up and devoted his entire State of the State address to the very thing that we're spending 30 minutes on here. That's what he said. It's the most serious problem facing the state of New Hampshire. So if that's happening there, it's happening all over this country.
Absolutely. Absolutely. And Suffolk County's population, I think, is probably greater than that of New Hampshire. And we're obviously close to New York City, and New York City has its own issues. So we are really sort of left out in the open, exposed to this issue here.
Well, even if we could put walls up, they wouldn't hold back then.
No, listen, they always find a way to break through those walls, and that's why we have to be vigilant.
So
about
in terms of of treatment. Are you satisfied that there's enough inpatient and outpatient care available so that if somebody got to the point and said, I need help, and you can't say to them, come back in 3 weeks, because by that time they would have lost their motivation. You've got to be able to provide that help when somebody finally decides I want to do something, or a family member says, my son is about to kill himself and I need to intervene and do something and get them into a serious treatment program. Are there enough slots?
No, there simply isn't. And the worst thing that we can do, if we have an addict who is looking for treatment, looking for help, asking for his or her life to be saved, the worst thing we can do is turn that person away or tease them with 1 or 2 days of treatment. So there aren't enough beds out there for inpatient treatment. There's not enough help for outpatient treatment. Part of the problem, as I said before, is the insurance problem. Hopefully we'll take a bite out of that problem with Senator Hannan's legislation. But there simply isn't enough. So this is a multi-pronged problem that that leads us first to education, second to that's the prevention piece, the treatment piece, and then another important part of the piece is the recovery piece. So once somebody's gone through 28 days of treatment and they're free of the addiction, they want to get their lives back in order. What we tend to ignore is that recovery piece. How do we help that individual put their life back on track? How do we find employment for that individual? How do we make sure that their living situation isn't conducive to them relapsing into addiction?
Are they getting ongoing counseling?
Are they getting ongoing counseling?
Ongoing counseling, right.
Exactly. So
to support them.
Right. So that's the whole sort of scope of what this task force is going to look at. The short answer to your question, are there enough beds? Is there enough treatment out there? The answer is no.
Well, what you've been doing is really important. People might be watching this and say, why is Suffolk County, why is this local legislator, so concerned? You talked about your personal story, but when people think about county government, they don't realize that, at least on the ground, it's the county government that has the responsibility to deal with the drug and alcohol and mental health problems that residents in our county. It's not something that's done by the towns or the villages. It's done by Suffolk County with help from the state and federal government. So I really commend you for doing what you're doing, Tom.
Thank you.
And
Thank
you have to come back and we'll talk more as this story continues to unfold and strategies get implemented. Thanks for being here.
Would love to.
It's
My
really
pleasure.
important. That's going to do it for this edition of MTL. I'm Pat Halpin, once again helping you meet the leaders.
Do you have credit card debt, or are you struggling to pay your mortgage? For nearly 20 years, Debt Counseling Corporation has helped consumers just like you. As a nonprofit credit counseling and HUD-approved agency, all of our counseling is free of charge. Our debt management plan could be the answer you are looking for. We were voted the first place winner in the Best of Long Island Awards for our services. Got debt? We can help. Call us today at 631-582-4300.
Yes, ready. Go get it.
Oh, come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
Why not join Smithtown Youth Bureau? I did. Volunteer with our Youth Advisory Board or join our programs throughout the year. The Youth Bureau is free of charge and we work with youth from birth to age 21 who live in the town of Smithtown. Programs run during day and evening hours. For more information on our winter calendar of events, visit smithtownny.gov. Click on the Youth Bureau under the Department tab or call 360-7595.